I'm here at SOHO 2025 annual meeting. This is the Society of Hematologic Oncology. And today I'm speaking with Dr. Megan Melody for My Hero 360. Megan, it's great to speak with you.
Thanks, it's so nice being here with you.
So typically we interview patients or families and caregivers about their health journeys, but doctors and other healthcare providers are obviously super important to the care that patients receive. So I want to talk to you a little bit about your role and how you work with patients. So can you just tell me a little bit about yourself?
Yeah, so I work out of a cancer institute called Tampa General. Tampa General Hospital Cancer Institute out of Tampa, Florida. It's a newer oncology center. I've been around about a little over 4 years. I primarily focus on the treatment of lymphoma, which is a disease of a white blood cell called the lymphocyte, and in particular focus on a few subtypes of lymphomas. So there's many different subtypes of lymphomas, and I focus on a few of those. I also utilize a therapy called cell therapy, which is where we often harness a patient's immune system to help fight their lymphoma.
Mm-hmm. Absolutely. And so can you tell me, you mentioned different subtypes, what are some of the rarer lymphomas that patients can experience?
In particular, B-cell lymphomas. So there's a subset of lymphomas which I see occasionally, but is not my specialty, called T-cell lymphomas. This is a cancer of a T-cell lymphocyte, but primarily what I do is B-cell lymphomas, which is a different type of white blood cell called a B lymphocyte. It's a cancer of the B lymphocyte, and like I said, there are many subsets of that. And we defined these B-cell lymphomas. We divide them into two categories typically: more indolent or slow-growing lymphomas, and then more aggressive subtypes of lymphomas. And each one of these types of lymphomas has multiple different subtypes as well, but each one has a unique, rarer phenotype. And so one of the ones I really wanted to speak about today was something called an indolent lymphoma. There's a rare subtype called marginal zone lymphoma, and often this is very low incidence. In the United States, I think there's less than 19 cases per million patients, so very low incidence in the United States. And it's primarily very difficult to diagnose because it has a multitude of ways that it can present. It can present primarily in the lymph nodes, which is a set of vessels that runs in a patient's body kind of parallel to the blood system where your immune system lives. But it can also present outside the lymph nodes. It can present in the GI tract. So it can present often as one of the primary presenting features when it presents in your GI tract is it can present as stomach ulcers and can be associated with H. pylori. It can present in the eye. So we actually define marginal zone lymphoma in 3 different categories, either nodal, extranodal, or even splenic marginal zone lymphoma. But I think given its variety of presentations, it can be quite difficult to diagnose. Mm-hmm. And then on the aggressive side of things, one of the rarer aggressive forms of lymphoma is something called Burkitt's lymphoma. Mm-hmm. And this lymphoma is rapid onset, rapidly growing cancer of the B lymphocytes as well. It's defined by a very specific genetic mutation, which kind of confers the ability for cells to grow very quickly. And that can sometimes be hard to diagnose just because these patients sometimes will have so much lymphoma in their nodal system that often we see a lot of lymphoma cells and also in their peripheral blood, and so sometimes they can be misdiagnosed as a leukemia instead of a lymphoma. And so I think sometimes that can be very difficult for patients. And so, I think both of these diseases, it's really important to get the input of an academic cancer center just to kind of confirm the diagnosis and make sure that the patients are on the appropriate treatments.
Right. And in addition to being difficult to diagnose, what are some other challenges that these types of patients may face?
Yeah, so I think for marginal zone lymphoma and Burkitt's lymphoma, like I said, these are rarer subtypes, and so the research in the areas for treatments for these diseases is a bit more sparse. I think one of the hardest things for lymphoma patients is making sure you get the correct diagnosis. So truthfully, for both of these rarer lymphomas, I do think ensuring the correct diagnosis is the most important thing. And so whenever my patients, if ever they ask, oh, would you be okay if I got a second opinion? I always tell them, absolutely. First off, I love when my patients get second opinions because I love to confirm that what I want to do for the patient is truly what another expert in the field would like to do for the patient. Or if ever there's some dissenting opinions, I think it really fosters a great communication. And so I feel that same way about pathology as well. If there is any ambiguity on your pathology, which is how we actually obtain a diagnosis for patients, is by reviewing the cancer tissue under a microscope and confirming the diagnosis. If there's ever any discrepancies or any confusion confusing parts about pathology, it's always great to get a second opinion just to really confirm that diagnosis, because that's truthfully going to make sure you're on the best therapy. And although, like I said, that these subtypes of lymphoma are all arising from the B lymphocyte, treatments between Burkitt's lymphoma and marginal zone lymphoma, which are both B-cell lymphomas, are vastly different because the diseases prevent vastly different, and their disease course is markedly different as well.
Right. So it's important to get the right diagnosis so you can get the right treatment.
Yes.
Yeah. And so obviously dealing with cancer is an incredibly scary thing for anyone. What do you think is important? You've worked with many patients and their families. What do you think is important to help them get through this, kind of time in their life?
It's a really good question. I think maintaining as much as possible a sense of normalcy and making sure that you're taking care of yourself. I think a lot of patients will come to me and say, okay, I know now that I have cancer and we're going to do this treatment, but what else can I do? And I always tell them all the things that your doctor's been telling you to do since we were little, right? Make sure you're getting enough sleep, getting 8 hours of sleep a night. Make sure that you are moving your body every day. That doesn't mean you have to go to the gym and run. If you never ran 10 miles a day, I don't want you to start doing it now that you have cancer, but getting out and moving your body each day, making sure you're eating a well-balanced and healthy diet. And I always include this when I tell my patients that there is no specific diet that we know of that treats cancer. There are some diets that have been suggested maybe help prevent cancer, but so far as of right now, there are no diets I know that starve your cancer. And so anything you're doing to your body, if you think you're starving your cancer, you're also probably starving your body. And so I tell people, make sure you eat a well-balanced diet, and sometimes that diet can include a cupcake, and that's okay.
Yeah, of course. Well, thank you for talking with us at My Hero 360 about this. I want to ask you a couple more things. So you host a podcast as well.
Yes.
Can you tell us about that podcast?
Yeah, so I am one of a few hosts for the SOHO Insider podcast. We interview experts in the field about pressing issues that are developing in the field of malignant hematology. And so most recently I hosted a podcast looking at a combination of Glofit Pola for the treatment of Burkitt's lymphoma, actually. And we are having a new podcast episode come out in near future looking at bringing bispecific antibodies, which are a novel treatment for the treatment of B-cell lymphoma, into the community, and how we can help improve patient access for that. So it's a really great asset to the field of malignant hematology to have this information from experts in the field kind of available on your phone, in the car. We can listen to them on our way to work, and so it's been a really wonderful experience.
Yeah, and as I mentioned in the introduction, we're here at the SOHO meeting. One of the missions of the society is about research and being able to provide excellent patient care. So, is any final words you want to say about the meeting and the impact that research has on patients specifically?
Yeah, I think in the past, I will say maybe about 7 years, the advances, particularly in the treatment for lymphoma, have just grown exponentially, and that cannot happen without clinical research. That cannot happen without the support of research funding, from the support of our pharmaceutical companies. And so I am just so grateful to be able to be a part of this community as these advances are made, but we can't make these leaps and bounds for patients and the treatment for our patients without the research that's being done and presented here.
Yeah, absolutely. Megan, thank you so much.
Thanks so much for having me.